everyone! Today I'll be talking about the thermogenic potential of brown adipose tissue in obesity treatment. But first, a little bit about myself. My name is Pranathi Manivannan, and I am a rising senior and IB diploma candidate at Strawberry Crest High School. My interests lie in the field of healthcare, and I am passionate about exploring innovative solutions to current health issues and contributing to the well-being of others as a whole. As for research, I'm currently working under the guidance of my incredible mentor, Dr. Gibbs from Yale University, to complete in vitro experiments concerning potential targets for obesity treatment. I've also been involved in research with the University of South Florida using molecular chemistry to create next-generation antibacterial treatments to combat pathogens. Outside of the science world, I lead a nonprofit initiative called Empower Ed, which works to support students with autism, special needs, and disabilities. Along with my team, we are currently working on opening a new school for these students. I'm also an ambassador for the National Cancer Research Foundation, where we raise thousands of dollars every year to support cancer patients. At school, I'm involved in FBLA, HOSA, and Student Council. Obesity as a global health issue is an understatement. As provided by the animation from the World Health Organization, the global obesity rate has increased exponentially from 1975. In 2024, more than 1 billion people are obese worldwide, making it a challenge for nearly every country on the globe. As measured by body mass index, obesity is a medical condition where a person has excess fat accumulation in their body. It can lead to subsequent health issues such as diabetes, cardiovascular disease, cancer, and even death. Without the correct treatment, this rate will only continue to increase. In 1997, the World Health Organization classified obesity as a global health epidemic, and this epidemic has widespread effects. Healthcare costs associated with obesity are staggering. In the United States alone, obesity-related healthcare expenses amount to nearly $190 billion annually. This includes the treatment of obesity itself, as well as its related conditions such as diabetes, heart disease, and certain cancers. While effective treatments for obesity exist, access to these treatments is often limited by socioeconomic factors. Many individuals, particularly low-income communities, lack access to affordable and comprehensive healthcare services. Workforce productivity is also affected because employees with obesity are more likely to experience absenteeism and presenteeism, leading to reduced productivity. Childhood obesity is one of our major concerns. The prevalence of obesity among children has nearly tripled in the last 3 decades. Childhood obesity often leads to lifelong health problems, including an increased risk of obesity as adults. Obesity also carries a heavy burden of stigma and isolation. Individuals with obesity often face discrimination and social stigmatization from healthcare providers, peers, and even their own family. Mental health is also another factor. Obesity is closely linked to mental health disorders such as depression and anxiety. The psychological distress caused by obesity-related stigma is draining on the mind. So what are we doing to solve this issue? One area of focus is brown adipose tissue. White adipose tissue has been considered the primary site of energy storage, while brown adipose tissue is involved in thermogenesis. However, recent research has shown that certain white fat depots have the capacity to undergo a process called browning, where they acquire characteristics similar to brown fat. Essentially, finding ways to induce this browning would activate the UCP1 gene, which would cause thermogenesis. This process, in turn, would increase energy expenditure, reduce fat accumulation, and potentially lead to weight loss. By harnessing the thermogenic potential of brown adipose tissue, we could develop innovative and effective treatments for obesity, offering hope to millions of individuals worldwide. There are several ways to activate brown adipose tissue. Some of these factors are shown here on this slide. Let's go through a few of them. Cold exposure is one of the most well-known activators of BAT. When the body is exposed to cold temperatures, it triggers the sympathetic nervous system, which releases norepinephrine. This hormone binds to receptors on brown fat cells, stimulating them to produce heat by burning calories. Hormones such as irisin, which are released during exercise, and thyroid hormones have also been shown to increase the activity of brown fat. Dietary components can also influence BAT activation. Certain foods and natural compounds like capsaicin found in chili peppers and resveratrol found in grapes have been shown to stimulate brown fat activity. Finally, epigenetic modifications are changes in gene expression that do not involve alterations to the DNA sequence. These modifications can be influenced by environmental factors or diet or physical activity, and they also play a role in the browning of white fat. According to the National Institutes of Health and several other journals, some studies have already shown some promising results. One study in 2018 showed the positive effect of pharmacological agents in inducing browning on obese mice. The results of this experiment are shown on these microscopic slides, clearly showing the browning of white adipocytes. A 2019 study has also shown the effectiveness of using genetics to personalize BAT activation strategies. Similarly, my work focuses on the effects of resveratrol, a naturally occurring substance found in grapes to induce browning and thermogenesis. I believe that it has the potential to revolutionize obesity treatment, especially since it is a natural substance and has proven to be a consistent stimulant of browning. The future of obesity treatment lies in how we can use the mechanisms of brown fat activation to combat obesity. By focusing on resveratrol, my goal is to create a natural and effective therapy. Testing different dosages of resveratrol allows me to find the best way to induce browning and activate the UCP1 gene. After I evaluate the increase in thermogenesis and energy expenditure, I will be conducting further studies to assess the sustainability and the safety of this treatment and submitting my work for review. The implications of this research extend beyond individual treatments. By developing effective strategies for brown fat activation, we can pave the way for new public health initiatives that promote healthier lifestyles and reduce the prevalence of obesity-related diseases on a global scale. This could also lead to a reduction in healthcare costs, an improvement in quality of life for millions of people, and a significant step forward in the fight against one of the most pressing health challenges of our time. And here listed are some of my references. As I draw this presentation to a close, I would like to re-emphasize the importance of addressing obesity as a global health issue. It's important for all of us to play our role, from becoming healthcare professionals to treat this issue, from spreading advocacy, stopping social stigmatization, to eating a nutritious diet and keeping ourselves and our families healthy. Thank you so much for listening, and please feel free to contact me on any of these platforms if you have any further questions about obesity or about my research. Thank you.